morning. I think it's morning still, so good morning. I hope that you all have enjoyed your time here at Empower 2025. I wanted to mention, that health plans are great at identifying risk. We know that. But really the true challenge comes when health plans now need to act on those risks quickly. Excuse me, I'm feeling a little under the weather. So there are successes that we'd like to see as a part of this, and it's going to require three things. It's going to require timely analytics that surface these opportunities. It's going to have seamless coordination between our partners and integrated data that removes silos. So today our goal is to leave you with practical strategies. We want to empower faster action. We want to have stronger quality and risk performance, and we want to have better outcomes for our members. So let's take an opportunity quickly to go ahead and meet our panelists. Jen?
Hi, I'm Jen Nagel, Corporate Quality and HEDIS Director at AmeriHealth Caritas. We are a national payer across the country, really focused on Medicaid, D-SNP, and exchange members. Most of my have over 25 years of experience in the healthcare industry. Most of it's been in the provider and medical economics sector. But 13 years ago, I was given HEDIS, which has been the gift that keeps on giving ever since. So excited to be here. Thank you.
Yeah, I'm Harin Wani. I work in product management at Inovalon. And most recently, I manage the product Inovalon's Data Lake.
Yeah. Good morning, everybody. And thank you for having me, Jamie. Diego Loinaz from DCO. I'm one of the founders of the company, and I handle growth development. So I work with the health plan, I work with the technology companies in growing our business. I'm also responsible for compliance, if that combination makes any sense. And my background is I'm a health law attorney.
Yeah, thank you all so much for being here with us today. So we've broken this up into multiple sections here today. We're going to talk about the base, which is our data. We're going to talk about that outreach that happens. We're going to talk about the outcomes that come from our analytics, the outreach that happens, and then ultimately, how do you pull all that together to make sense of that data to inform? And so let's go ahead and start with the base. So data is the true foundation of everything, and it's really important in determining those next steps, those next actions that we're able to take. So Jen, I want to start with you from a health plan perspective. How do you ensure that your data architecture supports both risk and quality initiatives?
Yeah, thanks. I mean, we spent the past day and a half talking about data. We know it's critical. And critical to support our business, our operational efficiencies, NCQA, and regulatory reporting. But I think the most important thing that we can never lose sight of, it's the backbone of understanding our members' history, and how we take that data and react to it. So to that end, it's critical that we have integrated single source of truth data repositories that are modernized and that are integrated, taking into account all the claims and clinical lab, member, provider, all the information required to truly understand a gap, ensuring you have strong data governance in your organization and that you have your data leaders collaborating and reacting to that to move it forward.
Yeah. And so, Harin, Inovalon is trying to help support this, right? And so what's Inovalon's approach been to breaking down these silos and ensuring the foundation for success?
Yeah, to some extent, what Jen said, it's mirroring what Jen said. When we bring the data in, we make sure that we normalize it on the way in or as early in the process as we can, so that we can always track the member in a consistent way through all of the systems that we have. The second leg is we make sure that the data strategy is optimized for speed of analytics and stability. So stability is just how consistently we can track this data in. And then just getting the data is just part of the story. Having the tools to actually make that data useful, whether that is the analytics tools to get insights out of the data, or connectivity through APIs, through vendors, through AHRs. That's the third leg that we focus on from a data strategy standpoint.
Thanks. And Diego, from your perspective, you guys are out in the field. So you're actually leveraging this data with patients. So how does that upstream data quality influence the assessment?
Oh, it's critical. But for the audience benefit, we perform not only in-home assessments, we perform all sorts of interventions. So gaps in care, readmission avoidance, telemedicine, telephonic HRAs, all sorts of interventions, because we're an extension of the health plan.
Mm-hmm.
So having that information from the multiple sources come to us from what you call upstream data is critical. If we don't have that information, we cannot deliver on the outcomes. Right? So,
yeah, it's really important, I think, and accurate data, right? So quick, timely, accurate.
And accuracy is key.
Yep. And so if you had to name a one must-have in a data strategy for closing gaps, what would that be? Haren or Diego, do you have?
I would say the more you can refine the strategy through that 360 view of your patient, and that means not just bringing quality and risk gaps together to look at the patient, but also their utilization, their social determinants, the way that you stratify and segment your different members. That can help you refine which members you go after and use your limited resources in the best aspect possible.
In our case, it's timing. Because for context, we might have a nurse or a doctor come into a patient's home. They have a schedule already. So we need to have the right information on that doctor's or that nurse's hands when they come into the patient's home. Not necessarily the patient will have that information.
Right.
So we need to have as much information as possible so we can validate with the patient and obviously corroborate all the data that's coming in. But timing and that precision is extremely relevant for us.
Yeah, love that. That creates the trust too then with the patient. Like this information about them as you're trying to care for them and take those next steps.
100%.
Yeah. So data is truly only as good as the insights that you get from it, right? We know that. So, but the insights need to be actionable, right? You need to be able to do something with it. So Jen, how does your organization determine what insights you surface up to providers and what insights you keep within the health plan to maybe inform trending?
Right. So, as a national payer, we have to ensure that we arm our providers with the information that they need because they're key, because they're member facing to the member. So everything that we need to supply them from a gap perspective, we really need to capitalize on that one touch that they have when they see the member or where they have any contact with the member. Mm-hmm. So we're arming them with all of the gaps that a member has. So for example, if a member is going in just for a typical well visit, we want to capitalize off of that, make sure they have their preventatives, whether it's breast cancer screening, colorectal, they have all that information, immunizations, what have you. But in conjunction with that, it's really ensuring that our providers are educating our members if they have a condition, whether it's diabetes or whether it's, asthma, that they understand their medication, that they're practicing good medication adherence. So we level set for those internally, but we arm the provider with all of those measures that are actionable and member facing with the member.
Love that. Love that. And so Haren, from a product perspective, we know in our research that providers are burdened with a lot of things, right? They're getting information from lots of different sources, their EMRs, their dashboards, their predictive models, all of that. But we really want them to take that next best action. So what are your thoughts on surfacing this information up to providers?
Yeah. So for providers to be able to have real impact with the limited resources, we need to make sure that we are looking at not just at what interventions we are having, but how many of these, using these predictive tools to essentially reduce the burden on these providers, right? So one thing is concurrent coding, where you inform the provider right at the point of care where they are missing some documentation gaps, etc. And the closer you can do this to within their EHR ideally, but if that is not something that you are doing right now, at the very least, you give them some tools that they can do it outside. The other part is that you are using all of your predictive algorithms to essentially identify where you can combine interventions, all of the interventions that you are having, all of the different modalities that you are having, and that all these modalities are aware of each other, so that if something has already occurred or it has occurred because the patient went to the doctor of their own on their own, that is recognized, brought back into the system, and then gets incorporated into your outreach planning, so that it's every touch point is meaningful.
Yes, so staying on that timing in your business, Diego, timing with these analytics and surfacing insights is really everything. It really matters. So how fast do you think it actually has to be to create that member outcome that you're looking for?
There's always room for improvement.
Sure.
But we're truly an outcome-driven organization, right? Because the health plan is looking to us to deliver the outcome. So, but let me, for context, again, just talk about what happens inside an organization such as ours. So Inovalon provides us the data. We grab that data. The first thing that happens is we got to turn it over to what we call logistics. Logistics includes our call center. So there you have an outreach. You need to get the patient's consent, right? And then you need to schedule that appointment and have the right provider for that member. So there's all sorts of logistics that happen using technology, right? So there you have the data stream going on. And then we finally have that patient interact, complete the encounter, report back the outcome to you guys, right? So you can imagine that if there's an expectation of outcomes by a certain period or time, timing is everything. We need that information cured and as fast as possible.
So being able to understand health plans, goals, et cetera, as far as the timing of these outcomes is important as well. So not just getting the data analytics, but understanding the collaborative goal that everybody has together.
I can talk about that in a few minutes.
Yep. And Jen, do you have maybe a real world example that you can share with us from, surfacing these insights and how it may affect that?
So through our enhanced analytics and really utilizing the integration of our data, when we talk about lab data and claims data and clinical data and contact information that we have for the member, we're really able to refine our outreach strategy and really segment populations from a prediction, a target, and a ranking perspective. Again, we have all the members' history. We know their behavior. We know the members who go to the doctors on their own. We know the members who are new to our plan. We know the members who do not go to the doctors and have comorbid conditions, right? So we're able, similar to what Hiren said, really segment the population for outreach. And what we saw in doing that was that our outcomes improved and our strategy and cost decreased.
That's awesome.
Yeah.
Good results. That's what you're looking for.
Yeah.
So, after we have our data and we've identified those actionable next steps, now we truly have to go in and execute on this. And so, Hiren, I would like to start with you from a technology perspective. It plays a big part in creating those efficiencies and workflows. So how are you thinking through the design of technology that can help streamline these fragmented workflows and coordinate processes better?
Yeah, so sticking with the theme of the three sections, right? How data and analytics comes together. You can streamline your workflows by bringing together your analytics as much as possible at the data source creation to where you are running analytics yourself. You can streamline how you bring all of the data together through either normalizing all the data, having it in a single location. And then you can streamline the interventions like we talked about by making sure that all the interventions are aware of each other and that you have that connectivity both to the health plan so they can respond quickly. That's where my product Data Lake comes in, but also to other vendors and EHRs so that those decision points that we have determined, the interventions that we have determined are getting communicated as quickly as possible to the ecosystem. And the ecosystem is telling us, like DCO is telling us, what has been completed, what has been collected as a result of these interventions.
When we were talking yesterday, it came up that health plans sometimes have upside of like 100 different vendors that they deal with across the board. I didn't realize that, honestly. And so that is a big part, I think, of coordinating, right? And making sure that everybody is aware and that bidirectional data flow is happening against all of them. So that way everybody's informed and we don't have duplicative work happening as well. So Diego, from your perspective, what's the one thing that health plans maybe often underestimate when it comes to assessment documentation?
That's an easy one. It's visibility. We work with risk-adjusted programs, be that Medicare, Medicaid, ACA, whatever. If we don't know what they're working on, what their pipeline looks like, we cannot deliver outcomes by a certain date, right? So understanding what the health plan strategy is and what type of interventions, volume of interventions they're expecting from us is critical, right? So, I explained the process of what happens once we get the data, but I would be remiss if I didn't mention that nowadays, as compared to probably 10 years ago, it's a challenge to keeping the network, what we call the network, meaning the physicians, the nurses, whomever is doing the work, solid, because the problem is that if we don't understand what is the demand that we're going to have, those nurses and doctors will look for work elsewhere.
So resourcing
right. So if we have visibility, I can make sure that I have the proper network all set up for when you need it. If we don't have the visibility, it's not flipping a switch and delivering outcomes. It's not that easy. Right. There is some work ahead of delivering the outcome.
Yeah. And Jen, when this documentation and care coordination improve, I imagine your ROI does too, right? So how do you see that show up in your metrics?
When it's aligned and you mean your rates will tell the story, I think. When it's aligned and it works, your rates will improve. You'll see your member care gaps close. You'll see your outcomes improve. And on the flip side, you'll see it from a negative perspective. Your rates decrease. You look at it from a data nuanced tech spec perspective and kind of action that forward. But there is a way to see that alignment through your rates. And then what I will say from a care coordination perspective, and I talked a lot about contact information and member contact information. When we're using data, it's not as simple as, I have a member and they have one phone number and then we're good to go. I mean, in working and analyzing and synthesizing the data, we have members that have 4 or 5 different phone numbers from 4 or 5 different systems, some of which are the same, some of which are different. So again, it's really using that integrated data, capitalizing on that data, and ensuring that your care coordination team and your organization is armed for what they need to do to outreach to members and ultimately contact providers to get the care coordination so members get the care that they need.
Yeah. I agree 100%.
Yeah.
Yeah. And Diego, going back to you then, where do you see maybe the biggest risk of breakdown? Like it could be handoffs, it could be documentation, engagement, or something else.
There's always risk in all three, but data hands-off are really great opportunities, right? You talked about multiple sources and the sharing information. We have internal hands-off as well, but I would say that it's definitely for us, the biggest area of opportunity that we see in healthcare altogether.
Yeah. So I'm going to stay with you here. So you, now that we have like our action items, right? We need to engage our members and create those outcomes we desire. So how do we just avoid creating more reports, more dashboards, and just ultimately change behavior for our providers and our members?
Yeah, change behavior. That's a big one. But we're an intervention organization, but where we see the great opportunity is if you see those interventions on a longitudinal basis, that really can drive change. Because, for example, we in our logistics and our algorithms, we try to assign the same provider to the same patient if we can for different type of interventions, right? But imagine if we could be responsible for making sure that that patient navigates the system. Because one of the things is, okay, we conducted a gap in care. I hand the information back to the patient. Now, what does he do?
Yeah.
What does he do with it? Right? So looking at the patient experience on top of all these interventions, at least from an organization such as ours, we see a great opportunity right there for all health plans. If they see those interventions, we as an extension of health plans, that can really drive
and I think
through behavior.
Yeah, and if you create that trust between the providers that are going into those members' homes or meeting them wherever the case might be, you create that trust, you create that friendship between them ultimately as well, where people aren't like, oh, they're just looking to close gaps. They don't really care about my health. No, like we actually do care about you. We want you to be healthy. We want you to have the best care possible. And I think it conveys better when you create that relationship.
Absolutely.
Yeah. Jen, do you have an example where better analytics maybe change those outcomes?
Yeah, I think so. I think the theme is getting data faster and how are we utilizing it. And so in collaboration and partnership with Inovalon, in using their data lake, we were able to shave off about approximately 5 days from when we executed our flow chart to actually having our member detail in our lake so we can execute on that. So what does that mean? It means I'm able to identify a care gap faster. I'm able to refresh my internal and external reporting faster. And I'm able to get my gaps out faster. So there's that perspective. And again, it's the analyzation of the data. I talked about member phone number, same concept with a provider. So when we talk about outreaching to providers for our members to close gaps, it's really important to understand that just because a member, they may have an assigned PCP that just comes in from the state, but that does not mean that the member sees that provider. So how do we make the most of the touch, right? Touch to the member, touch to the provider. It's utilizing all of this data that we have and going through and able to see the last provider seen. So I know this member saw this provider on X date. May not be their PCP, but it was a provider. I know they had their HbA1c on this date. I know they had their BP with this date, and I knew who they had it with. So as a result of that, we're able to take this provider information and build upon that for prospective and hybrid chart-based locations. So we find the chart information, know where the member's going, know who the provider is. So it's that holistic view that we're really trying to get towards.
Yeah, I love that. Haren, what's this look like in your world? Because it's a little bit different. So what does measurable success look like for you?
Measurable success looks like what Jen just said, right? Yesterday, when we were preparing, she came up with this on her own, and I was so gratified because for us, our customer success, our customer satisfaction is the metric that I'm driving towards. And then the other part of it is that we are tracking our customers with non-customers, right? We are looking at, are our customers doing as well as our non-customers? If you look at our STAR or our quality improvement program, customers with us are doing much better on STAR ratings than the customers who are not with us. I think for the health plan, it is similar, like making sure that the members have that satisfaction as well as success in terms of their outcomes is probably what we want to track. And then we want to track against other health plans to see how our populations are performing compared to the other health plans. Inovalon can obviously give benchmarks and other things to support that, but in the end, it's about finding like populations and seeing how they compare to determine where you need to have more impact.
Yeah. And I'm going to go back to the trust equation really quick with you, Diego, because you guys are in the field. So is there a certain thing or way that you try to build that trust so that the providers and the members believe and actually go out and act on the insights that you're giving them?
Yeah, that's a great question. Well, in terms of the members, so we are very intense with training our providers, our staff, our call reps, everybody with soft skills, right? Because not necessarily the patient knows us.
Yeah.
Right? So we got to be able to, in a short amount of time, to earn their trust, and then deliver on the outcome. And when this is a call to everybody and all the health plans. It's important, and even in Inovalon, it's important that we return that information as quickly as possible to the patient, because patients sometimes feel, well, okay, so they came in, I don't know what happened.
Right.
They closed the gap, they perform a test or something, a sample, what's the outcome? And what happens next?
Yeah.
So I think one of the call to actions in terms of the member and earning their trust is how fast do I return the information and how actionable that information is for that patient.
Yeah, the education for them, right? The next step for the member.
So important.
Great, you're here, you just did all those tests on me, but what do I need to know about the results of those tests? What do I need to know about taking care of myself when you're not here?
And usually, theoretically, you should send that patient to the PCP. But like what Jen was pointedly saying, not necessarily there's a connection between that PCP and that member.
Right.
Sometimes they don't even know each other. They would subscribe to them, and not necessarily are they connecting. And that's why you have organizations such as us that bridge access, right? Either be that we're going into the patient's home or with a telemedicine intervention.
Yeah.
In the case of the providers, it's quite different. And I'm not saying, let me take a step back. So definitely doctors and nurses, they have a huge burden, administrative burden to deal with. But I have seen through my career that doctors are happy if you pay them quickly. And this might be blunt, but it's true, right? If you're, for example, demanding that they submit a pre-auth in order to receive that, well, let's make sure that that pre-auth doesn't become an obstacle for payment, right? They have a pre-auth, then pay them quickly. That's our experience. That's how we work, actually. All the arrangements that we set up, we make sure that our providers are paid as fast as possible. That way they will respond, they will deliver better outcomes. They don't have a problem of documenting whichever way a particular health plan wants to document the record. We can have that information fed back to the health plan. They don't have a problem with that as long as you pay them properly and obviously
quickly.
Timely.
Yeah. And so we've covered a lot here today with the importance of data, actionable insights, care coordination, member engagement, and ultimately outcomes. So in our last 5 minutes here, I want to have maybe a final thought from our panelists. If you could give this audience just one action that they should take back to their organizations, maybe that would help them close gaps faster, create better relationships, pay more timely, whatever the case might be, what would that be from your perspective? You all are in very different organizations.
I can start. I think from the health plan perspective is really streamlining your data and being able to refresh it as quickly as possible and reacting to that. I mean, the goal is to shorten the gap between actual data gap capture to clinical action. We want to be able to shorten that gap. And you see it in the industry. You see where we're going from FHIR, right from DQM. The whole goal is we want real time. We want all of these systems formatted in a way where they talk to each other with the ultimate goal of holistically understanding the member, getting them what they need, identifying the situation, closing the gap, making sure they have their care. If we can get that in a way and those data elements are streamlined where it automatically feeds into reporting, I think that's a pretty good situation to be in.
Win.
Yeah, it's a win.
So just staying with the same thought, I think first of all, have an inventory of your data. I can't tell you the number of times I've been having conversations with someone at a health plan and they are not aware of a particular data set that another group is getting from us. Things like social determinants, things like that. So take an inventory of the data that is coming into the organization. You might find duplications, you might find ways to streamline. Second part would be to make sure that you can thread the patient and the provider through all of those data sets, that they are either shown consistently through an enterprise master patient index, or there is some kind of a matching that will tell you this individual is this individual, because they will change, they will move, their providers will change. So you will need to have a very active patient management in your data strategy. And then same for provider management. And the last part will be, don't forget the tools. Like all the data can be there, but if like the data that you input into analytics is not getting combined with the data that is coming back from analytics and you can't use that to optimize your analytics, then you're leaving something on the table, is what I would say.
Yeah.
Yeah, I think since yesterday's keynote, today's panel, and even over there in the pharmacy session right before this one, we're all big in technology, and we feel fortunate that we have you guys as partners. But there is an element there's a human element here, right? So Dr. McKay from Google was talking about if you could bring the clinician earlier into the even product design earlier, that's amazing, because really the collaboration between the human side and the technology is essential if we really want to drive true behavioral change, like you were saying.
Sure.
So,
Love that. Well, we are right on time. So I want to thank you guys for being here with me today. And I want to thank everybody in our audience.
Thank you.
We are doing a demo. We have a demo theater just after this. So if you want to see anything about provider enablement or data lake, we'll be around to the other side of the hall.